Department, Dagmar Wood with our Platte County Commission, Erin Sanders, our Epi Specialist at the Health Department, Dr. Teresa Hills, local dentist and board member, Kathy Wright, board member for the Health Department, Jeff Taylor with the Riverside Fire Department, Sarah Williams with Platte City Pool and Pub, Kat Robnett, who is our emergency response planner for the Health Department, Tammy Saylor with Park Hill School District, Dr. Colvin, you're on there, hi. Josh Colvin with Park Hill School District, Jonathan O'Reilly with the Rock of KC Church, Rusty Savage, pastor with First Baptist Church of Platte City, Robert Locke, Parkville Alderman, Steve Hager with Truman Medical Center and Alderman for Platte City, Scott Monses with Truman Medical Center, Michael Rose with KCI Expo, Harold Rowland with Argosy Casino Riverside, Jen Snyder with Witt and Hicklin, Jim Baber, Wells Bank, and did I miss anybody?
Dale Brook.
Thank you.
Hartford Commons, the National.
Thank you. Anyone else?
Dr. Jackson is also here. Dr. Jackson is also on now.
All right.
Oh, good.
Mike Reich with Platte County Schools also.
Okay, thank you, Dr. Reich.
Yes, and Jay Harris with Platte County Schools is also here.
All right, thank you. Anyone else? All right. Well, thank you all so very much for being with us today. I just want to let everybody know that the meeting is being recorded, and we appreciate Platte County Sheriff's Department doing this GoToMeeting for us and doing the recording. I just kind of want to open up with a few words just to say that I really appreciate everybody working together as we move forward. And I just want to really focus on those words, working together, because that's really what we're all trying to do in a positive fashion to adhere to this guidance that's been set before us to really safely start to plan to reopen our county. And I just want to talk a little bit about what it means, the novel nature of this virus. You know, we're all really living in a massive scientific research project here. If you think about it, it seems like a lot longer than 4 months, but it's only been 4 months since this appeared on our radar. And if you think about that, that's a really short period of time to gain knowledge about the virus, understand its impact, develop and perform testing, assimilate the data, discover pharmaceutical and non-pharmaceutical measures to fight it, and as we're doing today, start to plan for best practices to open the county. So if you think of all that in 4 months, that's kind of daunting. But we've been given a huge responsibility, as you all are very well aware, to make decisions and set guidelines for when it's safe to open our county, so that it doesn't result in a large spike in our cases. And we all know that could sicken a lot of people and, you know, cause lives to be lost unnecessarily. And that's why we are again following the national guidelines that are set up of opening America again. Just want to remind us all too that we're asked to not repeat history, and some information that I've been given is that when the SARS outbreak in Toronto of 2003 happened, they opened too early, and there were many people became ill as a result of that. And with this COVID-19 pandemic, Japan opened too quickly with the same result. So we really want to avoid that in Platte County. I have heard from many of our citizens on both sides of this decision, some pleading for us to open to save their businesses, all of our businesses, and end the economic downturn, while others are begging us to not open too soon until it's been determined that it's safe. And our low case count in Platte County has given some people a false sense of security that the virus has really minimally impacted our county. But while we all know testing across our country as well as our county has been woefully inadequate to really make a true assessment of that case count. I would like to applaud the Platte County citizens for their adherence to our stay-at-home orders, which has really helped to mute the effect of the virus in our county. The social distancing, as we've called it, is the #1 non-pharmaceutical method to fight COVID-19 until we have a vaccine, which is probably a year down the road. So having said that, I just want to say I purposely didn't put a time frame on this meeting since it's our first time to meet, but want to be respectful of everybody's time, kind of hope we can stay somewhere around 2 hours on this. I've seen other meetings like this that have gone well over 2 hours. So we'll hope that we allow everybody time to speak, but yet I think we all want to be home for dinner. So, all right. So our agenda is on the screen before you, and I just wanted to move to don't really have an official mission statement for the group, but I just wanted to let you all know that our mission is really to provide information to our Platte County Health Department Board of Trustees so that we can assure the safe reopening of Platte County, as well as assisting our businesses with developing their individual plans. So that's our mission. The Board of Trustees for the Health Department and I are the ones that will be taking this information and then moving forward. So we appreciate you all very much participating with us. And now I'd like to move to Erin Sanders. She's our epidemiology specialist here at the Health Department, and she has information graphs for us.
Okay, so just going to go over some graphs and some information on the data in Platte County and how the COVID-19 is affecting Platte County residents. So this first graph that you see is our total cases. Platte County residents in Platte County, Missouri, outside of Kansas City limits, those cases get reported to the Platte County Health Department. So, and as Mary Jo said, those are only laboratory confirmed cases. So these graphs show cumulative cases, including Kansas City, Missouri. Those get reported to Kansas City, Missouri Health Department. So total for the region, we've had 65 cases in Platte County total. And also, you can see our daily case counts, they sort of peaked around April 10th. As far as we can tell, that's the day we got in the most cases that reported to us, and that's the day that the lab reports them to us, and then we receive them from the laboratory. And so we've had about 6 cases reported since that peak day, and we are continuing to see hopefully a decline in cases, but again, that's sort of only dependent on how many laboratory tests are done.
Aaron or Mary Jo, can I ask a question? This is Scott Montez.
Sure, go ahead.
How many cases can you all reasonably track to do your patient touches, you know, when you do your tracking back to see who they've been in contact with? How many cases a day do you think you could handle?
How many can we handle?
Yes, ma'am.
Well, we're going to talk about that, but I guess we can go ahead. That's one of the triggers to know that when you're ready to move forward. So currently we have Erin, who is our full-time epi specialist, and then we've also trained up one of our full-time RNs to assist her, and then we brought in a PRN as needed RN that is trained up as well. She actually previously worked in communicable disease at the health department, and we are preparing to train up a couple of our health educators. So Erin, what would you say, each person can handle how many a day? I mean, it's really hard to tell because a person is not a person is not a person when you're doing epi tracing and contact tracking. I'll probably let Erin talk to that.
Depending on the length of the interview and the number of cases and contacts that they have, we could probably do about one person can probably do about 3 to 5 a day. There's a lot of paperwork involved also in tracking that information. At this point, the most we've had reported in one day is 3 cases. So hopefully as we reopen, we'll be able to keep up with that demand.
Thank you. I'll hold all my questions. I'll just write them down. Sorry about that.
Okay. Erin, go ahead.
And so this next graph shows our cases by date of symptom onset. So these are only the cases reported to PCHD, which are outside of Kansas City limits. And you can see most of our cases, we actually had a high peak of symptom onset before our stay-at-home order. And since then, we've sort of just started to see a decline. So we think that part of that may be due to the stay-at-home order and the limited number of contacts. And we also have noticed when we do the contact investigations that the contacts for people are often very minimal because they do claim that they've been staying at home. So most of our contacts are household contacts, but we expect once we begin to reopen that people will have more and more contacts because they will be out and about doing more of their everyday life activities. So this graph is a picture of the regional data that we've seen. So at the Platte County level, it's really hard to make confirmatory statements about any of our data because our population is still fairly small. And as Mary Jo said, testing has been limited in the past. So the amount of cases that we have is not a lot to go on for a statistically significant look at trends. So it's also helpful to look at the region level because we know that diseases don't end at county lines. So as a region, our area, Platte County, Cass County, Clay County, we actually have pretty similar case counts when you look at the rate to the population. So our rate is about 65 per 100,000, which is pretty similar to those other outlying counties. Rates are a bit higher in Johnson County, Wyandotte County, and Kansas City, Missouri, Jackson County. And then as a region, we did appear to have peaked around April 10th. However, I would note that on last Wednesday, we did see another peak of about 93 cases, not as high as the first one, obviously, but we're not seeing really that sustained decline last week that we were hoping to see continue for the region. And then this last graph is just the state level cases counts. And I would like to mention that at the state level, about 2/3 of cases are coming from the St. Louis region, who started to see some cases before we did and are having much higher, about at least 4 times higher the rate of cases that we are seeing in the Kansas City region. So a lot of these numbers are reflective of the St. Louis region, but is good to note that the last couple weeks have been fairly stable, while not necessarily decreasing since that peak around April 6th that we saw at the state level.
Thank you, Erin. Does anyone want to ask some questions about all that data that was just shared?
So this is Dale. So the April 10th was the peak, and there's been a trending downward trend since April 10th is basically what I heard, with one day in there that did have a little bit of a increase, but never went above the peak. So the curve is still a downward curve since April 10th.
So Dale's question was that since April 10th, there appears to be a downward curve since April 10th, and that is correct.
Okay. Okay.
Okay, thank you. Anyone else?
Question, the metric that we're using here is number of confirmed cases. And I think as we all kind of know, that's a really odd metric since the number of cases is likely much, much larger, which also means the morbidity rate is much, much lower. Is that a correct assumption? And also, you know, is there, until we get full testing, is there any way to know the true number of cases, since, you know, the vast majority of that number could go up by 10 times? Maybe, you know, is that true? And then a lot are asymptomatic and minimally affected cases.
So it is true that the cases we receive are only laboratory confirmed cases, and we know, as much as you mentioned, all along there are lots of cases we've probably been missing. Unfortunately, there was not a system for those really to get reported to us without confirmation through laboratory testing. So yes, there probably is a lot of cases that are not being reported, and we really don't know what the true level of the COVID-19 is in our population.
But overall, the number of things we do know, the number is going down, right?
The limited number.
Yeah. Go. Thanks.
Aaron, is the number in the numbers that we're seeing, is it divided kind of in age groups like we would expect? Are more of the cases of those that are confirmed deaths from this in the, let's say, 60-plus-year-old patients? I mean, is that what you're seeing in those numbers?
I think at the state level, that's what they're seeing. People with underlying conditions and older people are having higher rates of mortality. Although I know in the KC region, they've had a couple of people in their 30s who have died, so it's not a blanket statement. But and obviously in Platte County, we haven't had any deaths, luckily, so we don't have those numbers at a very local level.
Okay, thank you.
Aaron, were you able, I'm sorry, this is Scott Montes. Aaron, were you able to see what the hospitalization rates for the metro area were?
Yeah, so we have some data that's been shared internally with the MARC region, and it appears that hospitalizations have been dropping gradually over the last couple of weeks based on the hospitals that are reporting into the Mid-America Regional Council.
Do you, a different subject, it looks like the bump last week was in Wyandotte County. Is that correct? And if so, do we have any idea what caused that?
I know that there was a delay with some Quest reporting to be sent to the health departments in the region, so that may partly explain that bump last week.
Yeah, this is Mary Jo. It was reported to us that there were 3,500 tests that were kind of a delay being reported to the State Department of Health. And not all those were positives, but just a massive amount of 3,500 results that came into the state that they needed to process. So, you know, that could skew some of the numbers. So,
This is Marwood from Platte County. Oh, go ahead.
Sorry, Dagmar. It also looked like there was a bump up in Buchanan County as well. Is that a similar thing, or is there another little bit of a outbreak up there?
I know up at Buchanan County, they've had several positive cases at the Triumph pork plant up there. So that was like I'm not sure on the number, but I know there was probably around 15, I think, that were positive at one point, but I haven't kept up on that with the daily basis. So,
What kind of plants?
the Triumph pork plant up there, pork meat processing plant.
Okay.
This is Dagmar Wood, just a housekeeping item. It looks like there's citizens that are trying to log in that cannot, and the phone number that was posted on the website is not working, either the phone number or the access number. So I'm getting multiple communications that people are trying to get on and they can't do that. Can somebody at the health department check and see if that's operable and if we can open this up for the public?
Yes, thank you, Dagmar, for letting us know about that. I'll have my sheriff's department individuals check into that. We're actually relying on them to help us out with that. We'll check on it.
While we're talking about, the number of cases being, the number of tests that are going out there, of course, we're going to see when we increase the number of testing, the number of confirmations will increase. And the health department directors, I think, have said that in some MARC meetings as well. But this is a very new virus, like you said, Mary Jo. This has only been on our radar screen for 4 months. And there's ongoing information that's coming in different states. So there's apparently 2 studies in California and 1 in Delaware and 1 in New York City that's trying to capture larger populations of people and finding out whether they've got it, had it or not, and just didn't know about it. But it appears from these studies that like Newcastle County, Delaware did a study on their waste treatment, on the sewage that's coming out of that county, and they know how much it's collecting, and they're seeing that a lot more people have had it, probably at least 15 times more people have had it than what they believe, which means that, and they're not going to the hospital, they're not being tested, but they just have very mild symptoms. And so these are people that are going to be flying under the radar screen, but they're not getting tested, but there's a lot more people out there. So that means that the mortality rate of this disease, if these figures are true, the mortality rate is a lot lower than what is the 5% or whatever. So there's also a Silicon Valley in California has a test on this, and they're seeing that there's a 50 to 85 times higher reported infections than what has been, that they're out there, they believe, than what has been reported. LA County believes it's 28 to 55 times more than what's actually been reported. So it kind of indicates there from 4 different studies in 3 different states that this virus is way more communicable, way more out there. We're just not having these people, they're not presenting with symptoms, or they're just, convalescing fine at home, and they're flying under the radar screen. But the good news is that people are not dropping like flies, which was originally thought when the virus first came out, when we're doing lockdown orders and things like that. So, one of the discussion points in the Mid-America Regional Council's COVID group meeting, and they've had 4 meetings, I believe, so far. From the very beginning, this group there were a lot of health directors or health professionals. They were saying that they strongly urged our 9-county community to adhere to not pulling back on any restrictions until 2 weeks after any peak were to happen. And they were adamant about holding back on keeping the restrictions in place until 2 weeks after the peak. So understanding that, our county has had very few cases, and our region actually looks to have peaked at about the same time as Platte County has, April 10th. 2 weeks after that peak would have already passed by now. That was could have been April 24th. So can we talk a little bit about, I don't want to put you on the spot, Mary Jo, but what is the feeling for pulling back on that order safely? Of course, we want to be safe, but I don't really know of any virus out there where we demand 0 deaths in order to loosen any restrictions. So would you mind addressing that, please?
Yes, thank you, Dagmar. Actually, we have a little more information we want to give, and that's the next section I was going to talk about, and that's the triggers set out by the national guidelines that say you're ready to move into the next phase, and that's all part of it. So I'm going to let Dan give a little more, Dan Lubert, the Assistant Director of the Health Department, give a little more information, and then we'll go right into that, Dagmar. Thank you.
I wanted to make the advisory group aware that you have a web page. I'm sure many of you already know that, but I will pull that up on your screen so you can see how to find that on the Health Department's website. So for those of you on the phone, sorry, this may be difficult to follow, but the website address is www.plattecountyhealthdept.com. So if you get to the home page and then you scroll down to the announcements, which are right here. Just a second. And then you scroll to the Platte County COVID-19 Advisory Group and click on Learn More. That announcements are a slideshow, so you may have to scroll to the right to get to the advisory group page. So on the COVID-19 advisory group page, it starts with a summary of what the group is all about, followed by the plan as we've developed it thus far. Also on the page are meeting agendas and meeting minutes. And then there is a place for public comments. We have set up an email address, advisorygroup@plattehealth.com, which you can click on this link to get to that address. And those emails will not be responded to, but the public comments will be posted on this site. And you can view those if you click on this public comments received link. After that, there's a roster of advisory group members. So please look over that. And if you see anything wrong with spellings or information on there, please let me know. Or you can let Mary Jo know. The next section is helpful resources. And it's really difficult to find any great detailed reopening plans. Tennessee seems to have a pretty good document. There's also a document put out by Johns Hopkins School of Public Health, and I'll click on that. It's Public Health Principles for a Phased Reopening During COVID-19, Guidance for Governors, but it has some really good information in it and a lot of good resources. I've tried to capture some of those resources as businesses work on developing their plans. Here are some resources they can use for some assistance in that. And this is a living page, so we'll be adding resources to this page as they become available. And not every type of business is listed, so we certainly will be asking the advisory group for input and I think assistance in helping some of the businesses develop their plans, or at least help them find resources to develop their plans. Thank you.
Thanks, Dan, for that quick overview of what's available on the Health Department website. So now I'd like to talk about the triggers to move to a reopening phase. And Dagmar mentioned, the 2-week time frame, and that's the very first of those triggers. The Board of Trustees and I met on the 24th of April, as was that 2-week time frame, and we discussed, the data and moving forward. And what the board asked is that we hold this meeting today, which was set up, and they would like to meet tomorrow to discuss that further. After hearing from this group and having had time to do some research into businesses and what their readiness is. And I've heard from several businesses throughout the county, which is wonderful. They're sharing their plans. But to get back to our triggers, so as I said earlier, as set out by the national plan, there's 4 triggers that say you are at a point where you can consider moving to reopening. And the very first one is sustained reduction in cases for at least 14 days. Erin has some information, over the last 14 days where we were a couple weeks ago, and I'll let her now share that information.
So you saw on the graphs before that in Platte County, we do seem to have had a somewhat sustained reduction since our peak, since April 10th. We did see a few cases reported towards the end of last week. I think 4 cases last week and 2 cases the weeks before, but those are much lower levels of cases than we were seeing in the first 3 weeks of the outbreak. So that is some of the data that we see that's indicating that we are seeing that drop that hopefully continues before we begin to reopen.
Thanks, Erin. And then the next trigger is that hospitals are able to treat all patients with COVID-19 without crisis standards of care. We do have a report that's not shareable with the public, but where hospitals are all setting as far as their bed availability, their ICU beds, ventilators, PPE. Steve Hager, on the call here, would you mind sharing a little bit about your hospital?
Sure. This is Steve Hager. I'm Alderman in Platte City. I'm also Corporate Director of Safety and Emergency Management for Truman Medical Centers. And I'm co-chair of the Healthcare Coalition and the Hospital Subcommittee for the region. So we had our leadership call this morning. We have a 2 o'clock bi-weekly conference call where the hospitals share what's going on. When you take a look at the hospitals and where we stand in preparedness at this time, the hospitals are all doing quite well in regards to total number of patients. I think we're very fortunate that we had elected officials that were insightful enough to put processes in place to limit the spread of the disease early, and then the hospitals were aggressive in canceling elective procedures, and not even elective procedures, we like to call it that, but we've canceled many essential procedures and are holding on that at this time in order to reopen safely. And when we take a look at personal protective equipment throughout the region, many of the hospitals are still operating in what's considered a crisis care status. It's situational. It's when resources are inadequate, but we must provide the best possible care given the situation, despite some risk to the patients and to our staff. So at this time, I believe I can pretty safely say all of the hospitals are continuing to use PPE in fashions that we are not accustomed to. So normally we would wear a mask for a single use, dispose of that mask. Next time we enter a patient room, we would be wearing new masks. Pretty much all of the hospitals are reporting the same thing, that we continue to reuse our PPE. We're not necessarily putting people in N95 masks like we normally would for a potential exposure because of inability to get those. So I think from a hospital perspective, none of us are running at the level that we would feel comfortable running at on a routine basis. To some of the comments made earlier, when I think we can take a look at the overall numbers, and we can expect to see the number of cases continue to climb, and because we have more testing. So to comments made about we are seeing a lot more people than what we necessarily take credit for on the tally sheets, which is most likely true. However, when you take a look at the most vulnerable parts of our populations, those are people that have most likely fully sequestered themselves and have removed themselves from the public as much as possible. I think we're very fortunate that our hospitals in this area have not been overly burdened with case count. And it's because those that are getting the illness most likely at this time are more likely to be out and about in public. and are not sequestering themselves. But I think when you take a look at who's most susceptible, it's the people who aren't getting out. So we can be very fortunate in the fact that we've not seen a higher death count and everything else. I've talked to many colleagues and companions across the country, many in New York City, where they've been seeing those higher counts, and the stories coming out of there are very, very sad. And the healthcare workers that are being exposed to this unduly with less than appropriate levels of PPE and everything else, I think we should count our blessings in this area.
Steve, this is Dagmar Wood with Platte County. Could I ask a question, please?
Absolutely.
I understand that Children's Mercy Hospital just furloughed 575 workers because there's just not enough staff. There's not enough patients there. I talked to our CEO of St. Luke's Northland. These hospitals are actually hurting because they are not seeing this huge influx, and they've canceled their quote unquote elective surgeries. I personally know of a friend's sister whose brain tumor surgery was considered elective, and that was pushed off, even though she's passing out, by the way. But 575 workers furloughed, and our hospitals hurting financially. Can you speak to that, please?
Oh, absolutely. I would completely agree to the fact that hospitals are hurting. So they have electively dropped their volume of patients, both through surgeries as well as clinic appointments. And that is in an effort to reduce the overall burden on the healthcare system. Part of the reopening strategy is to make sure the hospitals maintain the capacity to deal with a surge. And if we started doing essential procedures again, which I believe all hospitals are looking at based on our conversations regionally, but our biggest hangup right now is to make sure we have sufficient PPE. And once we reopen, if there is a spike in numbers again, we lose a lot of the intrinsic capacity that we have right now because our numbers are down. So when we take a look at our overall surge capacity, obviously we've artificially inflated that surge capacity because we're all running at about 50 or 60% of our capacity. Children's Mercy, when you look at pediatrics overall, there's a low prevalence of severe impact in that category. And they have, Children's has also electively reduced their patient visits because children not only come in by themselves, but they have to be brought in by parents and everyone else. And we're still exposing staff members to that potential disease. So I can absolutely say hospitals are financially struggling, and we would have loved to have opened weeks ago, but to the point of the criteria outlined, it's having sufficient PPE, and we still struggle with that on a daily basis. We're hoping to see all of the different industries who are promising to start producing PPE, ventilators, et cetera. I know this morning we were taking a look at some PAPR units, some air purifying respirators that Ford is manufacturing. NASA just announced that they had some. We're looking at masks from a variety of locations. We've made huge investments in KN95 masks, which are coming out of China, and we're seeing very low success rates in being able to appropriately fit them to our employees. They're just not truly designed for good protection, and those are what's most readily available, but we can't rely on them because they're not fit testing appropriately. So the hospitals struggle to have adequate PPE, as do most of the first responders.
And Stephen, this is Dagmar again. I do know that there are healthcare facilities, offices, hospitals that are looking at different sanitizing techniques to be able to extend the life of their PPE. And I am hearing PPE is an issue. I do understand that. I understand in our nursing homes, our long-term care, that's a huge issue. And I'm actually working with Todd Fain, who's a school board member, to get donations of those into those hands. But my understanding from what was reported to, I just want to throw this information out there at the MAC group meeting regarding COVID. They were saying, I think it was our very first meeting, that this region has always had the resources to be able to handle any surge. We have enough hospitals, hospital beds, ICU beds, ventilators. That issue has never been an issue for this region. So that's what they at least reported at this MAC COVID group meeting, which consists of healthcare workers and electeds and all that. So
I'm on those meetings as well. So I would agree with that statement based on what we've seen. If we started seeing large increases in numbers, you know, New York City, when you take a look at their total bed count and such, we are fortunate. We have a lot of hospitals in this area, but it not only comes down to having beds, and, you know, my organization, we've sat there and we've looked at where would we expand, how can we add ICU beds, et cetera. So, for example, probably 4 weeks ago, St. Luke's announced that they added 100 plus ICU beds. Well, that's artificial. No one has been out building new buildings and adding 100 beds. They looked at ways to adapt capacity to deal with that. We've got the same plans in place here. You have to have staff to do that too. And if you see a third of your workforce out with illness or afraid to come into work because it's spreading within the workplace, then having beds doesn't mean much if you don't have the staff and the equipment to support it. So I would agree that in Kansas City, we've been very fortunate. If you look no farther than St. Louis, they were the first in the state to look at hotel to healthcare setup. We've identified the same opportunities here. St. Louis was worse off than what we were, but they also started a little bit later than we did on the stay-at-home orders. So again, I give full credit to the elected officials in this area for being proactive and putting in orders in place to support public health.
Just before we get off this subject, I want to bring to everyone's attention, there's a Missouri, this is Scott Montes, there's a Missouri Hospital Association COVID-19 situational awareness dashboard, and it shows a summary of all the hospitals in Missouri. And the last report that they published, 33 folks came off ventilators, and there was only one death in the last 24 hours. So that's a good sign that we're learning how to interact with the virus and treat patients and get them off of ventilators. So that's very good.
Scott, could you copy and paste that website onto the chat box so that people can go to that, please?
I will work on that, and I will do that. Yes.
Thank you.
Yeah, I would agree to that, and I would also say too that I fully believe that again, the cases that we have seen are people who are out and more mobile. The people who are more susceptible are staying home and staying isolated. So we're not saying those people have to be on first. That would be most at risk.
That link should be out there for everyone to click on and look at. And that's across Missouri. So that's not just Kansas City. I don't know what the Kansas City numbers are, and I cannot speak to the Truman numbers. I'm not authorized.
Okay, thank you both for that wonderful conversation there, and hopefully answered some questions and gave a little more in-depth info about hospitals. I do want to interject here with the phone number. Again, if you're having people contact you, it's 1-848-777-1212, and the conference ID is 9511774. Dan, maybe you can put that in.
It's on our website.
It's on our website, but can you put that in the chat box in case anybody's wanting that to pass on? All right. So that was the second trigger, the hospitals being able to treat patients. The third trigger is all symptomatic people can be tested. Now, there's a lot of testing opportunities in different places throughout our area. Some of our hospitals are doing their own testing. Physicians' offices are doing some testing. And the Platte County Health Department, thanks to local donors, we've been able to start testing last week. And this is with an agreement with KU Medical Center. So the first week, our capacity with the testing kits that we were allotted was 125 tests. And this week they've expanded now that KU has, been running these tests for a week now. They've increased us to 250 tests that Platte County Health Department can run per week. So I don't know how many testing kits are available at any other facilities, but that's a huge increase for us. So that's very good on our triggers that we're able to do additional testing. We're running that through a drive-through capability down at our Parkville facility. And all of the tests that we've done so far, I believe it's around 50, they've all come back as negative. So that too is a good sign. And then the last trigger is that public health can maintain active case and contact isolation and monitoring. So that's what we were speaking to earlier, the gentleman that asked the question, how many could we do in a day's time? And, I explained we have one full-time epi specialist, another full-time RN that's been trained up to assist with that, and an additional assistant epi specialist with additional staff going to be trained up very shortly here. So that the reason for that is so that when the reopening happens, there's always a spike in cases. That's just people are out and about more, so you're going to be exposed to each other more. That's just very traditional and expected. You're going to have additional cases. So we want to be able to handle that increase on the back end with public health, disease investigation, and contact tracing. So we can handle about 8 to 10 per day is what we would be able to handle. Hopefully we won't see that. So that concludes the phasing, talk about how we determine that we are ready to move forward. Are there questions from the group about that?
Mary Jo, this is Scott Montez. I have a question on Trigger B, if the hospitals are ready to declare out of crisis mode. Is that still pending, or is that now yes?
Well, as Steve was talking about, they have the bed capacity, they have ICU beds, ventilators seem to be available, but the whole PPE issue, I think we would need to double down and check with hospitals I would rather not speak to that and ask the hospitals to give us that yes in that column.
Okay. And when do you anticipate ask them if they're in crisis mode or not, depending on the PPE? Are you going to do that in the next few days, or?
Yeah, we'll be doing that. I'll need that information, before our board meeting tomorrow. So we'll get that information. So.
Thank you.
Mary Jo, I'll have to drop off. Like I said, I do have our call at 2:00 for the hospitals. I will pose that question to the hospital group, and I will get back with you. And when I was speaking as the co-chair for the region, not specifically for Truman itself, but I think all of the hospitals have been indicating the same positioning.
All right. Well, Steve, thank you very much. That was very helpful information. Glad you were able to join us for as long as you could. And I'll look forward to your information that you'll provide after the meeting. Okay?
Absolutely.
Thanks.
Mary Jo, Jeff Taylor with Riverside Fire Department. Just one quick question. With that, you're saying that we've gone through phase 1 already and we're well into our way into phase 2, and meeting that criteria. Is that what I'm hearing?
Well, we're assessing our situation where we are with phase 2, being with the triggers that I was just discussing. So,
Can I clarify that one? We're still in phase 1. We are still in
Yes.
phase 1. Thank you.
yes. Yeah, those triggers, the way it's worded in the national plan, is triggers to move to phase 2. We can talk more about any of that anybody wants to, throughout here. But I just wondered, Commissioner Wood, could we ask you to speak a little bit about the disaster relief funds that Commissioner Schieber discussed at our board meeting last week?
Sure, this is Dagmar Wood. We really don't know anything else besides what Commissioner Schieber reported, and that is that we are expecting approximately $12 million in relief funds to be coming in through the county. We have not received any guidelines or requirements of what that looks like to be distributed. Kansas City, Missouri is apparently asking for, based on population, they're about 49–50% of the population of Platte County. They have asked the treasurer to carve out $6 million of that before it comes to us or after it comes out to us. So that would mean the county has $6 million of these relief funds to have allocated or granted out. I don't know if they're a reimbursement, if it's a reimbursable expense, like there's a COVID expense and then we just go ahead and reimburse that. I expect that there's going to be maybe some kind of application process, but the funds need to be used to open up our businesses as soonly and safely as possible. And that's what he indicated a week ago, is that's where that money needs to go, is to open up this county and to open up our businesses safely and as quickly as possible. We would like to see the input of this committee on that, but the decision ultimately rests with the commission. So we have, like I said, we have not gotten any more information from State Treasurer Fitzpatrick on what that looks like, but we're hoping to get that information pretty quickly. So that's all we know so far.
Right, thank you very much. I would like to hear from the people on the advisory group here. What suggestions do you have? I know Presiding Commissioner Schieber asked that last Tuesday. What can we do to help these businesses be ready to open and so that they feel safe, as well as our citizens that are coming into these businesses so that they feel it's safe, because they need to have a comfort level. I just listed, on our agenda, some things that I thought would be a good thing to be able to purchase for our businesses, like masks, gloves, sanitizer, cleaning supplies, so that doesn't have to come out of their bank accounts to start off with when they've been struggling to start with. But I'd love to hear from the rest of you as to any suggestions or ideas you may have.
This is Bob Watt.
Okay,
Go ahead, Bob. Yeah, no, I was going to say I'm the Parkville alderman, but I'm also a business owner, and I've talked to a number of business owners. Businesses in general realize there's two aspects to safe reopening, and a lot of businesses are terribly different. We have restaurants, we have attorneys, we have CPAs, we have hundreds of different types of businesses. But we also know that there's two things that we need to have to open. One is we need to protect our staff, and one, we need to protect our customers, our clients. So there's a variety of different guidelines that we can have for that. But one of the things we've got to do in this whole narrative is give business credit for being smart. If it's going to cost me $500 to buy masks and I can open, then I'm going to do it. I don't need county's help. I just need county to get out of my way so that I can do that. Give me a guideline that, yes, I need to do that, and I will do that, and get a positive message out there to people that here is what is going to be done. I'm going to disclose what I'm doing to open my business. I'm assuming other businesses will do the same to assure customers, to assure their staff that what they're doing is safe. I think from the previous discussion, what I hear from the medical professionals on the call is that the mortality of this is maybe not as bad as what we thought. If the cases are extremely higher than what we're thinking, if the number of hospital beds in use are much lower than what we expected, then maybe if I'm smart in what I do to protect people, I can do that. I recognize a tremendous degree of contagion in all of this, but I also hear from people that if I practice the safe social distancing that we're discussing, if I practice hand washing, if I track people that come in and out of my office, then we're fine. But if I shut down too much longer, I can't protect the people that need to be protected. I've got 25 people that I take care of in my office. I've got to protect some of them because they're older. I've got to protect some of them because they have health issues. But I can't protect them if I can't open. And if we're holding this whole thing hostage because the hospitals may or may not have enough PPE, and I realize that's a significant issue, but if we hold the whole thing hostage because of that, then I may not be able to afford healthcare insurance for my employees. And the whole system goes down. And this thing gets geometrically worse as every day we hold overly onerous processes out there over people's heads. That's the balance that I'm looking for as a businessman. And that's my input as to how to get things moving again. Is we're smarter than people like to dictate to us sometimes, you know. So with that, I'll turn it over to Dale.
Yeah, I'll just reiterate what Bob said. I mean, I've talked to numerous people too, limited more to my tenants here at Parkville Commons, and you know the conversations are, you know, we will be ready to open when we can open, and I'm getting more pressure to want to be open than not be open, and I think Bob's right. Most people, I could almost say all people that open and run their own business have to be pretty savvy, have to move quickly on their feet, and they're already preparing for this. I mean, you know, I sent you, Mary Jo, I sent you my stuff for, you know, Lockwood Country Club because Cass County is May 3rd. I mean, we are anticipating opening on May 5th because May 4th we're normally closed. It's a Monday. And you know, and I'm sure you saw those are very detailed on what we're talking about doing. And it's on both sides. We're protecting our associates and we're protecting our members that come in. And I had a conversation with Bill Oliver, who is the manager and co-owner of the Nick and Jake's here in Parkville Commons, and the owner of Nick and Jake's. You know, they're developing their own through the Restaurant Association of Missouri. And I asked him, will you be ready to open May 3rd? He goes, no, we won't be, but we don't want to be, we'll be open, we want to be open before May 15th, but we cannot. Again, reiterating what Bob has stated, that, you know, the county, the health department's getting in our way. Again, most people that run businesses are taking into account everything that you guys are talking about here. And to keep continuing to delay it, you know, especially here in Platte County where there's been no deaths. The April 10th was the peak. You know, we all listened to Fauci and everybody, and they basically said 2 weeks. You know, I asked, why is Clay County opening? Why is the state of Georgia opening? Why is the state of Oklahoma opening? Because there is a give and take. There is a risk. There's no doubt about it. There is a risk. But you know, there's a risk in everything we do. There's a risk when I drove to work today. You know, so you know, I am one wishing and hoping, pressing that you know, maybe it's not May 3rd, but maybe it's May 8th, May 5th, whatever. But I think May 15th is, another almost 3 weeks before our business can open. I'm concerned about 2 or 3 of my businesses right in Parkville Commons may never open. Again, business owners are smart.
Yes, this is Jim Baber with Wells Bank. And I agree with the previous two there. If we could, go along maybe with state guidelines and not put our Platte County business people at odds, basically with Clay County and surrounding. We wait another 2 or 3 weeks. The ability of these businesses out there to reopen becomes more and more prevalent of maybe not having the ability to open. Say, looking back and seeing if we do have a surge, always have the ability to step back one maybe, but I think I agree with the previous two that it's time to kind of move forward here.
Again, I think most people, the general understanding, most people, if we do have a reversion back, I think everybody's going to realize that. And when the edict comes from Platte County Health and saying, okay, we've had a big spike, we're going to go back to where we were before, I don't think there's going to be anybody that can say, wait, no, you open, we're going strong, and we're not going to close again. I don't think they'll do that. I think people will realize that, okay, this could kill you. So, okay, we're having a spike, so let's retract it back and let's go back to where we were today, so to speak.
This is Dagmar with Platte. Is there when businesses close and employees are furloughed or laid off, they don't have access to their health care. They can't pay for their prescription drugs. They can't pay for their procedures. Mary Jo, has there been any kind of study or information that your health department is getting to learn about what the indirect impact is health-wise on our citizens, the mental health issues, increase in abuse? I understand domestic violence is up now. What that means, because I know, and I've parroted this information before to a lot of people. Stephen Moore is an economist who is serving on the White House's Economic Recovery Council. And he is of the opinion that for every 1% in our nation increase in unemployment, there's an additional 10,000 deaths due to these indirect consequences of COVID. And right now, the St. Louis Fed just put out that they believe that next quarter we're looking at a 32% unemployment rate, which means we've got about a 28% uptick in unemployment, which is 280,000 additional deaths in our nation. If half of that ends up panning out, this is still worse mortality-wise than the actual disease itself. I'm afraid the solution is worse than the problem. Would you mind, is there any kind of information that you're getting about the indirect impact, please?
I haven't received any statistics like that. We definitely have partnerships with Tri-County Mental Health that we can reach out to find out those types of information. Of course, our sheriff's department would be who we would check on for the, legal or the domestic violence and increased violence, those types of things. So, good question that we will look into. But as far as the economic part, we feel for all the businesses for sure that are struggling with this. But the whole economic image, I guess we rely on the county commission to provide that information to us, and we're bringing the health information to the table. So, so I thank you for bringing all that up. And, all of this dialogue that we're having today is exactly what our board was asking for. So this is good information that we are taking notes on, and we will, bring that before our board for discussion tomorrow. But if anybody else has more information to share, please feel free. This is the purpose of the meeting.
Mary Jo, this is Rusty Savage. Specifically for churches, I think it's really important for you to give some clear guidelines, because churches are looking, at everything from small groups all the way up to large, what has been considered mass gatherings, even as small as 50 or 250 or what that looks like. and then looking cross generationally, everything from infant and child care all the way up to older adults. And so I think it's going to be really important for you to give really clear guidelines and let us know what our mandates and what our guidelines and how we can respond to it. I think most churches want to be in compliance. You know, sometimes you see in the news the places where, you know, people are really sort of holding up a fist and saying, you can't make us. Most of us aren't there, but we really do need clear guidelines. No church wants to be the place that's known as a hot spot. So I think it's going to be really important for you to give good, clear guidelines across a pretty broad spectrum of need for input.
Mr. Savage, this is Dale Brook. I mean, I think it'd be better off if you developed your own guidelines and had them look at them and approve them. I mean, to have the health department put stuff together for every type of business is going to be relatively difficult for them to do. I mean, most businesses are coming up with, you know, their own thoughts, and you obviously hit all the things right on the head. You've got to worry about childcare or different ages. I mean, I would come up with your own, so it's like we do. I mean, our membership, you know, we have our youngest members 26, our oldest members, I think 78. I mean, so we have the same issue about how we can address those ages. That would be my recommendation.
Hey, Joe, this is James Berkalook.
Just 1 second, James. Could I ask anybody that we've had a request come in, anyone that is not speaking, could you please mute your mic on your computer so that we're not getting a lot of background noise? Thank you. And James, go ahead.
Yeah, and the comments kind of addressing some of the issues that have been brought up, but it specifically in the tier and some of the changes that go from tier to tier. And it's specifically this percentage of occupancy in businesses, including all types, including churches. I think tier 1 was 25%, tier 2 was 50%, et cetera, et cetera. And I think a better way of doing this, instead of tying it to percentages, to say, look, this is the minimum safe distance you have to have in your establishment, whether it's a church or otherwise. And then let people determine based on that criteria, which you can provide, how many people they can put in their venue, whether it's a church or a gym. And that way you get out of the business of saying percentage, and because some spaces are huge. I can go outside and fit 200 people if I put 6 feet between them. So maybe a better way of addressing, instead of a percentage in the tiers, is to say safe minimum distance within your establishment, and you ensure that you keep that for however people you put in there. I'm over.
Thank you.
Hi, Mary Jo. I just want to address this is Dr. Teresa Hills. I have a dental practice here in Platte City, and I agree with, you know, everything everyone is saying. I definitely want to get back to work. I have some of the same concerns that the hospitals do, because I can go back to work. I have the business. I can do, you know, we're trying to follow guidelines from the American Dental Association and the Missouri Dental Association as well. But I don't have enough PPE to be able to get back to work. You know, we're limited to the number of gloves we can buy, the number of masks we can buy at one time, the number of gowns we can buy, and they're wanting us to do all this stuff, but we can't get them. And so that would just be something I would love everyone to just kind of think about. If, you know, anybody has any suggestions for me, I'm sure all of the dentists in the county would certainly appreciate that.
Sure. Thank you, Dr. Hills. You know, Commissioner Wood, you mentioned Todd Fain. I know that he had early on, he had been working on, you know, gathering any donated PPE or people who maybe had access to purchasing PPE. So maybe we could do some type of a shared consortium, or, you know, if you have adequate PPE and you would be willing to share 20% of it, you know, just I think we need to all become creative so that we can help everybody get back to work. So that's a good point to bring up, Dr. Hills.
Yeah, I agree. One of the things that I'm not sure if these relief funds would allow, that I was personally thinking about, is having some kind of, there's a national stockpile of PPE, but having a local stockpile of PPE. And how we would get that, how quickly we could get that, if that's something that would help businesses and all that. I don't know if that is going to be an allowed expense under this relief fund monies that are coming, but I'm definitely open to doing something like that. So.
All right, Joe, this is Steve.
Sure, go ahead.
I might just point out that for us, it's not so much what it's costing, it's the availability. So the majority, so to Dr. Hill's point, I would think she's doing what's considered an aerosolizing procedure, which they should then be wearing N95 masks. The majority of what's out there right now are the KN95s that are coming out of China. We're finding about a 25% success rate in getting those fitted to our employees. So she's got a much smaller practice, less people than what we're dealing with, but still, if she has 10 people on staff, maybe 2 or 3 of them are going to fit successfully to the KN95s. So that's the biggest challenge we have right now. And they're still expensive to get them.
Thanks for that, Steve. One thing we might talk about too, once we can figure the PPE issue out, do other businesses who have spoken up on the line, would you be willing to share on our advisory group website on the health department's web, what your plans are, so maybe others can build off of yours is one thing. And then one idea is that would businesses be willing to post on their door or on a local, on a place that's very visible to the public about what they're doing to assure that the safety measures are, being provided within that location so that people can have a confidence level there.
Yeah, this is Bob Locke again. I mean, I'm planning on doing that with my firm. And we had a roundtable to discuss what they needed to feel comfortable. And they also said, publish those guidelines. I guess at the risk of legal issues with doing something like that maybe misses a point somewhere along the line, I guess that's the risk you have. But that's going to make my staff feel important. I think it's going to make my customers feel important. And I have no problem doing that. And people can add an item to it or give us other suggestions. I think it's a great idea, but I can't be held hostage to a guideline in here where I may not see anybody in my office for a week, and yet my hands are tied because of the policy that's trying to fit everybody. And I know it's a little off topic of your question, but it's there's a little bit of a surgical knife needed in this situation as opposed to a sledgehammer. And if you try to treat guidelines for everybody, I don't know if it's going to work, but I think my point was earlier is give people credit for coming up with guidelines, and I don't have any problem with giving you what our published guidelines are going to be, but I don't know that I want to wait till May 15th to adhere to them just because there's an item on a checklist that hasn't been done yet. I think that's very onerous for a county that's only got 65 cases.
Okay, thank you. Thank you. Anybody else want to comment in here?
Yeah, Mary Jo, this is Dagmar Wood again. I don't think I probably have to share with you that it seems like there are stores and groups of people that are starting to loosen these restrictions themselves. We're seeing packed parking lots, especially on the weekends, of big box stores, and and whatnot. And one of the probably things that your board might want to discuss tomorrow when they meet is, are they losing their moral authority with this community if they end up just not listening to the families of Platte County? If they stick with the May 15th deadline, are people going to just go out and do what they want anyway? And then where does that set you up for the next, if there is, God forbid there isn't, but if there's a next pandemic, when you have to come out in a couple of years, what are people going to listen to you? So I know that that has been a discussion in other boards, but really, I mean, it's not just a short game here with COVID, but you're looking at the long game for future issues as well.
Well, you know, thank you, Dagmar. It's definitely been predicted to us that COVID could have a second wave just seasonally, you know, with the seasonal influenza this fall. So, you know, all things have to be considered in this, and the public's ability to withstand all of this, I understand, and the board hears that as well, you know, that this is very difficult for everyone. How about schools? We haven't heard from schools. What are you thinking about for moving forward for this summer? I know you guys have plans.
Yeah, I can, Mary Jo, this is Mike Reich with Platte County Schools. I can give you what information I have available at this time. You know, in terms of summer school, right now, our conversation is centered around you know, different scenarios. We plan to do virtual learning for our high school credit recovery and for any students that require an extended school year in accordance with their IEPs. For special needs students, and that will happen for sure. We are planning for a physical summer school in July rather than June, but we also recognize that we may not be able to gather in numbers that large in July. So we are working on some virtual scenarios in July, but you know, essentially we're thinking of every possible scenario and preparing ourselves to go whatever direction we need. So flexibility and agility are the themes around our designing our summer school program.
Thank you, Dr. Reich.
Mary Jo, I'll add in just real quickly is we're Park Hill, exact same thing as what Dr. Reich shared in terms of moving forward and offering virtual summer school to high school students in June, and then trying to do an on-site summer school in July if possible. If not, we'll be ready to go virtually.
Okay, thank you very much.
Mary Jo, if I may add, you know, along with preparing for multiple scenarios for summer school, we're also preparing for multiple scenarios for when we return in August. So, you know, I think it's far enough away to where, you know, your guess is as good as mine, but we are preparing for things I never thought we would be preparing for, especially when one of the most valuable services we offer is childcare for our working families. But we're preparing for bringing in smaller groups, preparing for kids to come in shifts, along with perfecting and including virtual learning as part of a hybrid offering. So I just share that. You know, just so you're aware that we're not only preparing for multiple scenarios for summer school, but looking to next school year, hoping that none of this is necessary.
Yes, we're hopeful as well. So are you, as schools, are you all receiving guidance from the Missouri State High School Athletics Association for all of your, you know, athletic programs and events that you have?
Our MSHA has generally been slower to provide restrictions than what we are getting locally. And I think, you know, MSHA is much like, obviously they serve districts all over the state, and what their local districts need vary considerably from one district to another. So I would look for MSHA to follow suit with whatever, you know, our county and city health departments are considering, and then obviously with whatever comes from the governor. But right now we have not heard any information with regard to fall sports.
Okay, thank you.
Hey, Mary Jo, this is Michael with the Holiday Inn at the Airport and KCI Expo Center.
Sure.
I have a question. We've got 39 hotels, Platte County. A lot of full service, a lot more value insured or limited service. And most of the hotels, at least that are franchised, which is a majority of them, are getting guidance through their franchisors. And what I'm looking for is guidance from the county and from the city of Kansas City as to what's going to be allowed, what's not going to be allowed, as far as requirements for group gatherings. You know, the Expo Center, we can do up to 5,000 people, and it's really hard for us to decide what exactly we're going to do until we get that guidance from both the county and the city of Kansas City. I guess my question is, are you coordinating the efforts or will you be coordinating efforts on what that guidance is going to be with the city so that we don't have two different guidelines in which we have to go by?
Yes, as you have said, you know, anything with a Kansas City address falls under the Kansas City Health Department, and Dr. Archer and I, as well as other Metro Health Department directors, you know, we've talked about this very topic, how, you know, we have to have a Metro-wide recommendation for things, definitely for things like very large gatherings. So yes, that will be discussed as we move forward with that. I think maybe it might be a good idea, Dan, can you bring up the tier 1 of reopening the businesses? I think everybody's probably had a chance to look over that. So the first tier of reopening doesn't change a whole lot, to be really honest. You know, of course, everybody that are high-risk individuals are still definitely suggested to stay at home, and businesses, the 25% of your building occupancy, that is a suggested measure. James, I hear your suggestions of doing it more with square footage, something we'll definitely take into consideration. The one thing that's actually been implemented in the Wyandotte County phasing in plan is a suggestion that was made by Kansas City Health Department, and that is when we all start coming together again, it's going to create a potential for infection to be shared. So asking businesses to have some type of a sign-in sheet or electronic or paper with a person's name and contact information would really be beneficial behind the scenes for public health. And that may seem daunting, but if there is someone that becomes positive that was at your facility 3 days ago, a week ago, and we can very quickly contact them, the other people who were in the building, that will truly help keep the infection spread down and thus help us to be able to continue to move forward with the next tiered opening. So that's something that we've put in our draft plan here for consideration. And mass gatherings are definitely in the very first tier are not going to change from the number of 10. You just can't. We have to very slowly and methodically see what happens as we start coming back together. And
Mary Jo,
sure.
Well, but here's the problem with that tier, and you say 10 people and 25%. It becomes hypocritical to say other businesses who can't do that, they have to be limited. Again, when you have big boxes who are easily exceeding those limits, moreover, that are doing it before you even go to this first tier, that they can do it, but no one else can do it. And I think that's greatly hypocritical of the health department and people in charge to say that on one hand to these people over here, but on the other hand, you can't do it because you're not a big box retailer. I think that's vastly unfair.
I hear what you're saying. You know, these we didn't come up with these guidelines ourselves. This came from, you know, the national guidelines, but very good point.
Jim, James, weren't you making the statement about social distancing and maybe changing the wording there a little bit? Isn't that what you were asking about?
Right. Instead of saying 10 people, say, look, you have to keep 6 feet distance between each person and they have to have a mask. And then you let them figure out how to adjust that to their space. Again, if I'm at church, I want to do my service outside and I can fit 125 people with 6 feet in between them. Can I do that, or have to stay with 10? Or if my building will fit 50 people with 6 feet, can I do that instead of being limited by 10? Again, I think it's very inflexible to say 10 and not be able to change it for 2 months, which is what the tier says as far as moving between tiers. Because some folks will say, well, you're never going to let me go beyond 10, so I'm just going to do what the hell I want to do. And you don't want that, obviously, but you got to make it that you trust people to do the best thing to keep their business safe or their church safe and their constituents safe.
Mary Jo, can you hear me? This is Harold Rowland with Argosy Casino.
Yes. Hi, Harold.
Hello. To James' point, and I'm speaking not necessarily from Argosy's point of view, but for some small businesses, if you limit it to 10 and others, there's a hurdle they're not going to achieve, and they're better off not opening. That's got to be kept in mind. And everything you've talked about hosting, I'm working with, and all of the general managers of casinos, we're working with the Missouri Gaming Association. And we have a very aggressive phase 1 reopening that really focuses on social distancing, and limiting the amounts of people that can get in and out on the big box would really be unfair. But I would keep that hurdle rate in mind, because you have to look at your cash flow, and you might not be able to get there with certain limits, and I'm better off not bringing people back and just keeping the place closed.
Dan Luber with the health department here. Actually, what you're describing, we've had the same thoughts. Frankly, numbers like 10 and 50 do seem a bit arbitrary when you consider that some businesses have 1,000 square feet and others have 70,000 square feet. So there have been instances of some essential businesses that were allowed to, one, for example, had a 70,000 square foot warehouse. So they do have more than 10 people working. So we have taken that into consideration and will continue to do so. Certainly we'll apply common sense and appreciate the input. This initial draft was, frankly, much of it was adapted from previous or other jurisdictions. So there are things that aren't perfect about it, and we will definitely take that into consideration. That's a thought we've also had.
Dan, this is Phyllis Parker with the health department. I was also going to say it depends a lot on the age group of who's at a facility. I mean, you could take a daycare and it's, how many children are you going to be able to fit safely in that area without touching each other, hugging each other? And that's much different than how many people could you keep separated by 6 feet in a business, a law firm, whatever, that are all adults that are not going to climb all over each other if you tell them stay 6 feet apart. So I agree with all of you when you say it does have to be business specific. I mean, it's not it's not the same story in a daycare versus a law firm versus a restaurant. I mean, I do think these are going to have to be independently kind of come up with by each, facility. I mean, it's going to have to be that way.
Yes, I agree. Thank you all for everything you're saying. We also have looked at John Hopkins, as Dan referenced earlier. They have a nice spreadsheet of different businesses. So Dan and I have discussed, delving a little deeper into that spreadsheet for some overarching recommendations for businesses. Of course, as you all have said, really the best person to create your plans is you. And then we move forward from that, share with each other, and try to come up with something that's going to be safe and work for everybody. So, maybe for our next meeting, we could have, something along that line to present to the group.
Mary Jo, Jeff Taylor, City Riverside. Just one quick question is that, so we've been hearing a lot in the conversations as of today is that we have businesses that are coming up with their own plans. And with that being said, is if they're developing plans and have an idea like Mr. Locke has been talking about to safely open their business, is that something that they can send to the Platte County Health Department to help you make a decision if this is going to be something that could affect lowering that date? As you know, the City of Riverside has a multitude of businesses and business partners that are coming together and coming up with ideas on how to safely open their businesses and business practices to ensure that they're not part of the problem. With that is if they have ideas, have the ability to get equipment for their personal protective equipment of personnel and so on and so forth, is that something that the Platte County Health Department would be willing to take into consideration into this as an overall strategy?
Sure. And Dan, would the best way for that to be shared to be on the advisory group's webpage?
Yeah, I can send it.
Yes, those can be emailed to the Platte County Health Department at advisorygroup@plattehealth.com. And actually through the group's webpage as well. There's a link.
Anything else from the group?
I had a question.
Sure.
One thing when I looked at the tiers, it gives very specific guidance about criteria for going from tier 1 to tier 2. And my question is, do the tiers have to be followed, or whatever you come up with, must be followed sequentially, and must there be 1 to 2 months in between before you decide to move to the next tier?
Yes, the science behind that is the 1 month is talking about, so the incubation period is 14 days. So we have to be able to measure, are we seeing increased disease in the community because people are gathering and getting closer together. One incubation period will only indicate one level of disease. You have to give them time to see if we have a trend. You want to? I was asking if Aaron wanted to maybe give some more epi knowledge as far as that goes. I mean, do you understand? So if I get exposed and it takes me up to 2 weeks to come down with it, that's only, one phase. So then we have to see, so did I then expose 25 people, and those 25 then get sick? Because as you've all stated on here, you're all very aware that if all that happens and then it multiplies by 10 more people and 100 people, we're going to be in trouble here with a huge spike in our cases. So yes, I'd say we definitely need to stick with the 1 month period of time minimum, so that we will have time to look at the case count.
Right, and I understand that, but what that means is, though, if you don't provide some level of flexibility tier 1, then you might not get to tier 3 as it's defined for 3 months. And when you tell people that, again, that's very discouraging, depending on how you allow businesses to reopen by the tiers. So just taking that into account, I mean, if you go tier 3, it could take 3 months before you get to the point where you can start doing tier 3 things. So again, it really matters on how you clarify and define these tiers, however you do it, and what that means. I think everyone will accept that, but again, it's providing, I mean, I really think tier 1 is very restrictive right now, and to tell me that you won't get to tier 2 for a month beyond whatever date you decide to transition to recovery, what that would be.
Well, once again, you know, these decisions have been made in concert with other health directors who are physicians, who are very astute with the epidemiology and the knowledge of how to move forward with this safely. So I appreciate your comments. I understand what you're saying. And then we go back to the novel aspect of this virus of, you know, we're all still learning about it and what it's going to do. So we're trying to take all of that into consideration.
Mary Jo, and I appreciate that comment. One of the problems just with statistics that we're dealing with here is Platte County is so terribly low. And when you try to build it into a national model that we're doing here, you know, I mean, any kind of, you know, if we get 8 cases in a day, it looks like we've had a massive increase, and we could jeopardize moving to the next tier because of that. And so it's very onerous for us to think, because we are starting with a baseline of 65, that number we can improve on that a heck of a lot. And then there's also a comment in there that we have to reduce mortality. Well, we're at 0, so unless somebody rises from the dead, I don't think we can reduce that. You know, what I'm saying is that I don't know if this fits all, and I think, you know, I think Platte County's we're going to get penalized because of our low numbers to start with. And I'm not sure if that's even the metric we ought to use. I mean, I think we need to use a number of hospital beds or you know, a percentage of population versus cases or something. But just raw cases is not a real good metric on this thing. And I mean, as an accountant, I would respectfully introduce that, not as a medical person. So.
This is Dagmar Wood. I completely agree with what Bob is saying, and that's been one of my concerns too, is that especially when you increase the number of tests that are becoming available, a lot of people that have just not been symptomatic are going to be counted as this positive case, and then these cases numbers are going to increase. Everybody knows that the number of cases identified has been increased when you start increasing testing, but I think maybe looking, like Bob said, at the number of hospitalizations, that might be a good benchmark to see if we're increasing or decreasing in that severity. So
this is Scott Monsess. I want to speak to that a little bit too, from a school board member. We've told kids, our seniors, and I have a senior, so this is personal to me, so you can just take it as one parent talking. It would be very disheartening if come July 26th that we're in the same state, 0 deaths, hospitals, you know, they've got 6 cases in some of these hospitals and people are going home every day. If we're still locked down and these poor seniors that have already lost the end of their senior year, they can't do graduation, there's going to be a lot of unhappy people, including myself. That's all.
I hear what you're saying, sir, and we'll, you know, I wish we could predict, you know, how that's all going to look, but once again,
if it takes 3 months to get to when you can have that, the kids will be in college already. So that you're basically saying, you know, your summer's lost. I don't think you want to do that. That's all.
Mary Jo, if I might be able to share with everyone what the county is doing, our efforts in opening up county buildings. So our county commission has the authority to open and shut down our own county buildings. And we are working on a plan to reopen the county's buildings, the county-owned buildings, as safely and quickly as possible. We don't have a date yet, but we are working with our department heads and office holders now. And those buildings are the administration building, the resource center. Our parks have been open and our trails have been open, but our playgrounds equipment have been closed. But I just wanted to let you know that we are actually, our Platte County owned buildings and assets, and the Public Works building as well, we're looking at a reopening plan.
Okay, thanks for sharing that. What about a next meeting? So the board is going to meet tomorrow. Would this group want to meet Wednesday afternoon just for kind of a recap and looking at, like I said, maybe some more specifics from the Johns Hopkins spreadsheet? Maybe we can have an accumulation of business plans together that have been shared with us and keep forging ahead. How does that sound to the group?
Works for me.
Yep.
That's great.
What time, Mary Jo?
Okay, had a motion in a second, it sounds like. Just kidding.
Mary Jo, what time are you talking about having the meeting?
Is the 1 o'clock time, does that work as well as any for folks?
Yep.
Yep.
Okay.
Yep.
All
So
right.
Mary,
Well, yes.
Dagmar, when you meet with your board tomorrow, what can I ask what's on the agenda for discussion?
I'm bringing information to the board that we've gleaned from today, and then to evaluate and decide where we're moving forward.
Okay, thank you.
Mary Jo, I'd like to make a comment about your triggering about the hospitals being in crisis mode or not. I would really push back on them and ask them, if you're in crisis on your PPE, how many days of PPE do you have? Really make them get specific. Don't let them just kind of push you off to the side and push you into whatever, south of the river Kansas City wants. I think that, you definitely have to take them into consideration. Obviously you are, but I would really push back and make them get specific on if they're in crisis mode or not.
Good
because
point.
That I have not, until today, and I have not been in the meetings. So I'm a data analyst type person. I am not a clinical person, but I believe make them give you numbers on days, and because Clay County made this decision with something. I don't know what data they were looking at. Maybe reach out to them and figure out what data they were looking at for their hospitals, and try to find a piece of data that supports what the business folks want. Because you're going to make a rational, reasonable decision. I know that. But there's lots of data out there, and I would not just take their word for it. I would make them prove it to you, make them show you.
Yes, thank you. And I do know that we just received, I believe, at the end of last week, information that the state has the capability to do the refurbishing of PPE with the ultraviolet light. I mean, they're even using the National Guard to transport it, from any facility down to Jeff City, do the procedure and send it back. And the statement that was sent to us was that could be done up to 20 times with an N95 mask. So that's good news as well, as far as the topic you're speaking to here, as far as their critical capacity. So.
And I know for a fact that some hospitals are doing that, although I can't say which hospitals.
Okay. All right.
This is Steve,
Well,
and I can say I just asked the question on the regional call. I'm still on it, but I've muted them for right now. I asked the question, and all of the hospitals that were on the call indicated that they are still functioning under a crisis care model. They are still reusing masks. That is still consideration for everyone as they look to reopen as well. To Scott's point, initially we started having conversations with days on hand of PPE, and that very quickly became obvious that since this is so atypical with burn rate, I would have our supply people tell me we've got this many days of product on hand, and we would make decisions based on that. And for example, with one particular product, we said we have 16 days of product on hand, so we started distributing it. Within 20 minutes, we were out of product. And there was no understanding of how that made sense. Well, when you look at that, that's based on typical burn rate. When you start handing out product to every person coming in the door or to every employee, you shoot your burn rate. So that is very difficult to say based on this number, this is where we're at, because right now our census is down. If we see that number start going up, that's going to vary that quantity. So to say, tell us what your exact number is, doesn't cut it, because we're going through it in different rates.
thanks, Steve.
Steve, I have a question on the crisis. When they say crisis, are they saying that they are in crisis standard of care mode? Because that's not the general public is not getting that fact. I mean, they're laying off workers and stuff. So that's, what are they actually saying?
Between crisis standards of care and crisis care. And the definition of crisis care is it's situational. It's when you have inadequate resources. So crisis standards of care says if we have a person come in, we're going to vary our treatment, potentially like ventilators, who's getting a ventilator when. Crisis care is you're coming in and we would normally change out our mask in between every patient contact or our gowns. And we're not able to do that at this time. We are reusing supplies. We're treating supplies, to your point, of many of the hospitals using ultraviolet light or ionized hydrogen peroxide and other methods to extend the useful life of a product, where we would not do that routinely.
So right now, the hospitals in the Kansas City area are treating patients with COVID-19 without crisis standards of care. Is that a true statement?
Without crisis standards of care, yes. But
okay, because that's what the trigger says. So it's we have to be very careful when we state these facts so that we don't confuse the public on this. Yes, I understand we have a crisis in getting PPE, and hopefully the market will resolve that and they'll start creating more, right? I mean, there's a lot of money.
Absolutely, that's what we're looking forward to.
But there is we're not, I mean, in Kansas City has not ever been close to being in crisis standards of care.
Correct.
From what I understand.
Right. But when you look at the definition, we are operating in under crisis care standards.
Okay. Well, that's not the same term as what is on the trigger.
Correct. Yeah, I would look at that again. But our supply, it says, do we have a sufficient supply of PPE? And all of the hospitals have agreed they do not at this time. And that, I mean, that's why we're getting there. Most of the hospitals are looking in the course of the next couple of weeks to bring on more surgery cases and everything else, but still limiting it to essential services.
Right. But Mary Jo needs a yes answer on this item if she's going to open up Platte County on May 4th. Can she can she say hospitals are able to treat all patients with COVID-19 without crisis standards of care? Is that true today?
To treat the patients without crisis standards of care, yes.
Yes.
There is another
Okay,
criteria
that's it.
of
You don't have to go on. You don't have to go on. Yes, so she can say yes to that.
Yes to that one, but do we have sufficient quantity of PPE? The answer is no.
Right. Every day we're trying to get more. I totally understand that. Yes, and we will continue to do that.
So, Steve, for the lay people on the call that may not understand all of this terminology, could you explain what that means? I mean, is that dangerous or not for patients?
The quantity of PPE that we have, it's atypical. So we would not, on any standard day, reuse PPE the way we are today. And so it does create elevated risk to both patients and to healthcare workers with that.
Okay, thank you. Just thought there might need to be some clarity there. All right, well, we are approaching 2 hours of being on this call, and that's kind of what I figured it would probably take. Can we do sort of a last call if anybody has any questions, comments, thoughts that they'd like to convey before we wrap this up?
Mary Jo, I have one more comment.
Sure.
When I sat down and looked at the plan, one term came into my mind, and I called it lax flow. And it really means relaxation flow. I said, essentially, whatever the county does, if other counties are different in their standards and how they ease restrictions, I think what you might have is a flow of people from one county to the next that has lesser restrictions. And I don't think you can do anything about that unless you put up police on the highways. But one problem that might create would that be if you have more restrictions and people are taking their money elsewhere, that would penalize businesses in a county, obviously, with higher restrictions. And again, I don't know if you can do anything about that, and I think you probably thought of that. But the lax flow problem with different standards throughout the counties, including KC-Mo, is going to become an inherent problem, especially if everyone's not on the same sheet. And I don't know if you can do that, but I think the board needs to understand that concept, and I think they probably do already. Over.
Yes. Thoughts we've already had, but thanks, James. Anyone else? Okay, I think we'll call it a wrap. I know there's not been any great epiphanies here, but I just appreciate everybody's thoughts, comments, everything you've shared. And hopefully, from here we can take everything that's been gleaned from today and move forward. And we'll send out an invitation for 1 o'clock on Wednesday. Same type of format. Thank you all very much.